Welcome to today's press briefing. With us today are Dr. Chong Suk Kwan, Head of Communicable Disease Branch, CHP, and Dr. Gladys Kwan, Chief Manager, Hospital Authority. Dr. Chuang, please. We have 170 PCR positive cases, 41 from HA, 15 from the lab of CHP, and 140 from the private labs. And we have received 319 RAT positive cases. So altogether, today's positive cases stand at 489 cumulatively. We have accumulated 1,201,062 cases, 749,878 PCR positive, and 451,184 RAT positives. For these positive cases, 65 are imported cases, 51 PCR positives, and 14 RAT positives. 37 were picked up at the airport, 24 arrived on June 1st by 10 different flights, and 13 coming to Hong Kong on May 31st by 9 flights. 20 were picked up from quarantine hotels from days 3 to 7. There are 8 cases, and they were picked up after day 8. One is a close contact. The roommate was confirmed positive, and it was not going out to the community. There are 4 days 9, 8, and 9. After leaving the quarantine hotel, they meant to travel to the mainland, and they were picked up at the boundary, testing positive using RAT with very high CT value. One picked up on day 10. The case had the CT value 2024. It is likely to be a local case. There are 2 on day 10, CT 2627 by RAT testing positive. There were some community activities. So we believe that it's likely to be a local case. Another one, day 11. In April, the patient tested positive overseas. It is likely that it is a re-positive case. By way of information, yesterday, as we said, we've discovered that from our spot checks, we picked up more cases that tested PCR negative, but they declare positive RAT test results. Now for the numbers, meeting on May 31st, 150 RAT cases, of which 31 of them, or 21% of them, were tested again using PCR. They all tested negative. A week earlier, on average, were 17% or thereabout. I must remind everybody that anybody knowingly submitting false or misleading information, it is an offense, and there is a fine and also a custodial sentence. For care homes, there is one from RCHD, an instructor testing RAT positive, and the person testing RAT every single day. Now for that RCHD, the 9 residents, that these are for the mildly intellectually impaired persons, and there wasn't an outbreak at all. But one of the staff members tested positive, and all of the other people have been sent to quarantine center for isolation. For schools, there are 40 positive cases involving 34 schools. In one school, 1 to 5, positives. There are 37 cases testing positive RAT, 3 testing PCR positive. Now, for these 40 cases, there are 28 students and 12 staff members. For the 28 students, there are 3 from kindergartens, 13 from primary schools, and 12 from secondary schools. For the 12 staff members, they come from 2 kindergartens, 7 primary schools, and 12 secondary schools. There are 8 schools that have reported more than 1 case. There are 2, one of them has a jazz interest group involving 11 students and 1 teacher. On May 19, between 9 and 12 noon, there was a chess club going on involving dance. Now, 1 teacher and 5 students are tested positive. And on May 30th, the teacher developed a sore throat, and the students, between 31st of May and June 1st, they developed some discomfort. For the 6 students participating in the dance, they are okay, but they have to self-quarantine at home. During the dance sessions, they kept the mask on, but because of the long duration, there was some time in which they had a sip of water with the mask off, and under these circumstances, transmission might have occurred. The other one, it has some residential facilities. Now, for the jazz one, the students were in different classes. They belong. I mean, they were not having classes at the same time, but they had jazz dance together. The other school, there is some residential facility. There are 4 students. There are 4 blocks there in the school for residential purposes. And for 2 blocks, a total of 4 students, 1 student from one of the blocks, and the other 3 from another block. They were staying at different floors, and they all tested positive. We would keep this under observation, and all the roommates will have to be subject to quarantine or isolation. We don't have any cases arising from the POH, Temporary King Memorial College. For death cases, there is 1 more. A total of 9,089 cases from the HA. The total number stands at 9,167. In terms of the fatality rate and the inoculation rate, there is no major difference from the past. In terms of genome sequencing analysis, we have more cases of BA.2.12.1, possibly related to the McDonald cluster. Now, one of the cases in Block 6, Richland Garden, there is 1 more unit. There are 3 people belonging to the same family. They all tested positive, suspected to be of BA.2.12.1. There is another one suspected of BA.2.12.1, where we haven't tracked down the source, and a 29-year-old male living on Choi Hong Road, Kai Chun Yun and Kai Chun Court. There is another family who lives in Tai Gu Sing, Pun Yong Gok, suspected to be BA.2.12.1. Now, for this block, there are some McDonald cluster people who are living there, and they might be related somehow.
So for those that are related to the McDonald cluster, when it comes to genome sequencing, we have found 45 cases, and 32 of them, we found that they are linked to the McDonald cluster epidemiologically, or some of them are linked to the Lan Kwai Fong Hotel. And for Central and Iron Ferries, for Central, we have 2 new cases. In total, 33 cases from Central, 16 male, 70 female, age 17 to 30. As for Iron Ferries, 2 more cases. In total, 49 customers and 2 staff members, aged between 18 to 58, 30 female, 23 male. Yesterday, I promised that we'll take a look at the genome sequencing analysis of Central and Iron Ferries cases. Well, their strains are quite similar to the prevailing strain in Hong Kong, but these 2 strains are different. They are not from the same outbreak. And today we have 1 new outbreak place. It's in the Central and Western District, number 35 Puddingshire Street. It's a bar. Its name is LINQ. We have found 20 cases, and 10 of them went to the bar in the evening of the 29th of May, and 18 other people visited it on the 28th of May, and 2 customers visited on both evenings. 11 male, 7 female, aged between 17 and 58. And 1 of them previously went to Iron Ferries. It's also an Iron Ferries case. We are now talking to the bar. In the afternoon, we paid a visit to the bar, and now we are retrieving Leave Home Safe records from the bar. Dr. Kwan, about HA. Good afternoon. Now, 397 confirmed patients are hospitalized, and 57 of them are new confirmed cases. And for those in isolation wards, 71 of them are now in isolation wards, and 12 patients are in second-tier isolation wards. 36 patients are in North Lantau Hospital, Hong Kong Infection Control Center. There are 18 new cases among them. Yesterday, we reported that 2 patients were in critical condition, and there is no serious case right now. For those hospitalized, 12 of them are in critical condition, 7 are in serious condition, and for 7 critical patients, they are now in ICU. And yesterday, 1 64-year-old female patient passed away. She's not from a care home. She took 2 jabs. She's suffering from chronic diseases, and she's taking heart disease medicine. She also has lupus and heart beat problems. And on the 5th of May, she had blood problems, and she was hospitalized for observation and treatment. And she tested positive when she was admitted to the hospital. Her CP value was 33. She deteriorated, and there were a number of organ failures. She's been hospitalized for 1 month, and she passed away last night. Yesterday, 50 people recovered, including 31 of them have been discharged from hospitals. And up to now, we have 50,357 patients who have recovered, and 50,001 of them have been discharged since 2020. 62,737 people have recovered, and 62,381 of them have been discharged from hospitals. And today we have no new case of patients tested positive when they admitted to hospitals. As for staff, up to now, we have 23,382 staff members that have been confirmed, and 23,332 of them have resumed their working posts. Now it's question time. Please tell us the media that you are representing before you ask questions. I'm from Orange Media. I have the following questions. Lately, there have been cluster outbreaks and the number of confirmed cases has increased. So what do you think the present trend of epidemic is? In the coming few days, we'll have a long weekend. Do you think there will be a rebound? And will you be stepping up your patrols? And Dr. Zhang talked about bars in the central and western districts. One more bar has a cluster outbreak. So what is the age range of the customers, and have they taken off their masks when they and did they dance? And today we have 319 out 80 positive cases. So have you found any of them? They are actually negative after PCR. Has there been any false report? And it is reported that in the coming week, the government will gazette and classify monkeypox as a reportable disease. Well, do you think monkeypox will be transmitted to Hong Kong? Do you think there is a high risk? And will the HA be buying medication to tackle this new disease? As for the recent tendency of the epidemic, we have looked at PCR positive cases and RT positive cases. Yes, the numbers have increased when it's compared with the previous days. We have to monitor the situation. For RAT, we would review these cases, and some of them are negative. I do not rule out the possibility of a rebound. We are monitoring the tendency very closely. As for the Hong Kong U, immediate reproduction rate on the 25th of May is 1.07 to 09, so it's a bit more than 1. And for the point in time prevalence is 0.18. For sewage tests and positivity rates at community testing centers, we don't see a significant increase. If there is a rebound, will the epidemic affect the capabilities of healthcare institutions? So we have to look at the hospital admission rates and other rates. As for bars, for the latest cluster, we are still interviewing the customers. And they mainly drink alcohol there. They chat and they take off their masks. But there's no dance facility at this bar. As for the age range, it's 17 to 58. Just now I talked about the 30th of May. That is the figures that we reviewed. Well, we have to send the samples for laboratory test again. So today I can only tell you the figures from the 30th of May. 21% of the cases were found to be negative after a retest. And for today's figures, we have to wait for the test results. As for monkeypox, the WHO has asked every country and place to monitor the situation very closely. So we will list it as a reportable disease. According to WHO's information and other countries' information, well, yes, there may be a possibility that the disease will be imported. The incubation period of this disease is long. It's like 2 to 3 weeks. Now, if a person flies from one place to another place, or if a person arrives in Hong Kong from an infected district, we won't be surprised to find cases like that. But according to the WHO information, we understand that this is a communicable disease, but you have to be in close contact with the patient. For example, you have to touch the skin of the patient, or you have to live together. So it's not that likely that there will be a major outbreak in the community.
HA, our expert colleagues have been monitoring the development of the pandemic. We would observe the clinical statistics. We also have regard to the world organizations and the pharmaceutical companies' data. We will be liaising with the pharmaceutical companies, and when necessary, we will stock the right medicine. Now, TV. For the two schools you mentioned, what schools are they? Can you specify them, and where are they? What district? And for the residential school, are there students who are staying in the school, or any teachers staying there as well? For the LINQ bar, you mentioned 20 cases, but you changed the number to 18. Can you be more specific about the number? Maybe I didn't make myself sufficiently clear. Now, for the school where there is an outbreak, the one that teaches jazz dance, there's the Precious Blood College. There is an extracurricular activity teaching jazz. The other one is the 李寶春世界書院. Now, for the bar LINQ, every night there are 10 cases, but there are 2 cases that have been there twice. So if you look at the head count, and the number is 18. The lady at the back, please. Cable TV. Now, for the bar that you announced today, one of them has been to Iron Ferries. So is that really the source? You mentioned that there is no dancing there, but are there any DJs entertaining the guests? According to your investigation, is there a violation of 599G? Now, for the school teaching jazz dance, 11 students are taking part. How far apart are they when they're having lessons? Did they violate the social distancing measures? There are different classes involved. How many classes were involved? Do you think, do you see any merit to suspend the class? And also for the school with residential service, they're on different floors. Are they facing the same direction where they live? Is there a likelihood of vertical transmission? Yesterday, there was RTD on Hong Fuk Estate and Hong Lai Court. There are 20 odd cases picked up. Is there any transmission within the block? Is there in any way related to the clusters that are in existence? What is the source of the transmission? And does it involve any sublineage variant? Whether it is originating from Iron Ferries, there was a patron who's been to Iron Ferries on the earlier week. The patient also went to this bar as well. Whether this is the index case, we cannot differentiate. We have to wait for the whole genome sequencing to see whether the results match with one another. There are patrons who've been to both places, but the genome sequencing results differ. I haven't heard about any DJs playing music. We're not sure about the details. Now, when they are having drinks, they would take the mask off. As to whether there is any violation, the FHD was also around during the visit. You might wish to put questions to them. Now, for the jazz teaching school, there are upper classes and lower classes involving a number of classes. They are from different classes. But for those who are from the same classes, there are no other cases because the teachers' students will undergo RAT tests. So we haven't picked up any other students from these classes. So we do not see the need to suspend the classes for the time being. So the outbreak originated from the jazz class. As to the Leipo-Chun United World College, there are 2 students who are from a different floor. There are 4 blocks of hostels. They're scattered. These cases are scattered in different places. But since there are more than 2 students, we like to make a report. RTD, there are cases on different floors. In the block, there is indeed some transmission, albeit not vertically. There are a number of units that are involved from different floors. Lady at the back. HKO1. Now, for the retests of the RAT cases, you mentioned 319 today. Can you tell us this is the final number of RAT cases, or will you give us an updated figure, RAT figure going forward, or would you give us a preliminary RAT number and then subsequently give us an updated figure after the review? And also on the McDonald cluster, there is a new household living in Taikoo Shing, Punyang Court. How many people are involved? And the bar that is in question today, one of them has been to Iron Ferries. How did you track down this patron, or did you get the information from the decoration, or did you find out on your own? There may be other patrons who've been to these different bars. How do you track down their whereabouts? Well, we'd like to be more transparent, and we would announce the updated RAT numbers, because the percentage has gone up. It used to be less than 10%, and there has been a marked increase of late. Now, for the 319 cases, we would arrange for them to give a specimen for laboratory test. If on 2 consecutive occasions they test negative, we would delete the case, but we would identify whether this is a false positive or false negative. So it's not so much a question of updating the number, we're just letting you know about the proportion. Maybe tomorrow I'll be talking about the number for the 31st of May, but it doesn't mean that this is an updated figure, because we do need to have a longer time for us to update the actual number. It's not just by subtraction like this. As to the Taikoo Shing block, Punyang Gok, it's a family of 4 testing positive. For Iron Ferries, how do we track down these cases? We go by the Leave Home Safe app information. Now, people may be frequenting different places, and there are so many cases, and we may not be able to track down all the places that these people have been. So we would look at the incubation period and the close contacts, and that have been in contact with these people, and they will be sent for quarantine. They will be put under quarantine, and we will look at these cases. Now, we have picked up this LINQ today, and there is a cluster there with quite a number of cases. We know the numbers of these cases, so we know where they've been.
Next question.
Follow up on the announcement from yesterday about sending people being involved with new subvariants such as BA.2.12.1. How does CHB respond to people who are upset about the rule change, given that the cluster is growing bigger now at 45 cases, and people have been put in stressful situations being sent to Penny's Bay? And isn't this counter to what Chief Executive Carrie Lam said in April, that home quarantine arrangement will not be revoked? My second question is on whether this approach, sending people to centralized quarantine for every new subvariant that comes to Hong Kong? Is this going to be the policy going forward? And the last question is for Dr. Kwan. We've heard of a case where a child of 9 years old was separated from her parents when she was admitted to the hospital on May 28th. Fortunately, she was able to be reunited with her mother later on, but it was after negotiation with the health authorities. Can you give us a number of requests from parents to stay in the hospital with their children since March, when the policy was updated to allow parents stay with their children in hospital? And how many of these requests have you approved or rejected? Thank you.
You may like to refer to the press release we issued last night on the question you raised. I would like to reiterate that the quarantine of inbound passengers from overseas and isolation of imported cases has all along been in designated hotels or facilities. So there has never been any change for imported cases. For the local cases, we have been using the 5-tier arrangement of isolation of local cases based on risk. So based on individual risk, we can may send these people to a controlled environment for isolation if we consider there's a risk.
Thank you for the questions. So the HA, we have all along support the pro-child and also the pro-family practices. So if the parents have this request, we will try to facilitate and accommodate the list as far as the operational feasibility is allowed. So meanwhile, I don't have the stocking of the number of the requests, but we will discuss with the parents to see what is the difficulty and the challenge, and we try to accommodate as much as we can.
下一題，前面咗13位。
I'm from TVB, and yesterday there's another bar that has a cluster outbreak. Now we will be having a long weekend from tomorrow onwards. So how do you assess the risk of people going to bars? Do you advise people not to visit high-risk places in the coming 3 days? And for the BA.2.12.1 sublineage, and now there is another untraceable case. How do you assess the transmission risk of this sublineage in the community? I think all along, well, now we have been facing this disease for over 2 years. We all know that it's very transmissive. If you take off your mask, there is a likelihood of an outbreak. And even in schools, when you wear a mask, there may be outbreaks as well. So we advise the teachers and students to take tests every day. And for our CHEs, we also advise them to take tests. As for restaurants and bars, of course, they would run certain risks. That's why we have the Leave Home Safe app and vaccine pass. So even when there's a transmission, there won't be very serious consequences that is leading to deaths or severe cases. So if you are going to high-risk places, I hope you have full vaccination. And for BA.2.12.1, in the community, we have seen some silent transmissions. We do not find obvious epidemiological links. Some people may be living in the vicinity of certain cases, and there may be transmissions there, but it's not as obvious as those for close contacts. So these people may just say hello to each other. These are the characteristics of Omicron. Well, there are circumstances that you may think that are not that risky, but you may still get infected. So if you have been vaccinated, this BA.2.12.1 is actually BA.2, and experts think that even if you are infected with BA.2.2, is not that serious. When it comes to preventing severe cases and deaths, vaccination is very efficient. Okay, last question. I'm from Mingpao. I want to ask about our AT reporting. You said that you will review the cases, and if you find that they are actually negatives, then you will delete these cases. Now, before the 30th of May, how many cases were like this? That is, you have taken a retest by PCR, and you found that they were negative. So how many cases like this, and how many of them were deleted? And for the new bar, for those 2 days, at what time did the customers patronize the bar? And how many customers were there at the same time? What's the capacity of the bar? And for Central and Iron Ferries, yesterday you said that there were still customers that you could not come into contact with. So what are the difficulties of locating them? You have the vaccine pass and leave home safe records. So why is it that difficult to find them? And for the genome sequencing analysis, you said that there were 2 different strains from these 2 bars, but 2 customers went to the 2 bars. So which strain do they belong to? And for CHP, how many suspected BA.2.12.1 cases are there in Hong Kong, and how many of them have been confirmed? Well, for the new bar, it's from 8 p.m. to 2 a.m. Yes, that's for both evenings. And for the capacity and number of customers, our colleagues are now checking. So I have to ask them. I do not have the figure with me at the moment. As for the deletion number, I do not have the number right now. We have to look at each and every case. In the past, we have some old cases, and we would review them, and then they will be added back. So if those were RAT positive cases, we are still looking at them. So we will still have to look at them. As for the 2 cases, I'm not too sure whether the genome sequencing analysis results have come back. We haven't completed all the cases yet. Some of them have low viral load. For Central and Iron Ferries, we understand that there are 2 strains, but for that 2 particular cases, I do not have the relevant information now. And for these 2 bars, we still have customers who have not taken their PCR test. We will follow up on them seriously, and legal actions will be taken. I do not have the exact figure. I know that some of them have been tested already, but about several dozens of them still haven't taken their PCR tests. As for BA.2, well, for the suspected cases, and including the confirmed cases, 45 in total. Well, for the suspected cases, well, either they have very obvious epidemiological links, or they are L452Q cases. As for the number of confirmed cases, I have to go back and check again. I don't have the exact number with me right now. So among the 45 cases, I think maybe half of them, but I have to count again. Okay, we'll end the press briefing here. Thank you.